Welcome, my friends, to the Bob and Brad podcast. My name is Mike Keenitz, and today I'm interviewing Rick Olderman, who is a physical therapist. I am asking him questions from our audience that you guys submitted about leg pain issues, including hip, knee, and ankle, and different foot issues. So, without further ado, here's Rick. So, the first three we're going to ask all at once because they all have a similar answer. So, Kate Joe said they have peroneal tendonitis and ankle strengthening, please. That's what they want some exercises for. The next person called Meldulicus. I have excruciating shin pain at night. Any ideas for exercise? And the third question is from Katie Margason 6. Is there any way to get rid of posterior tibial tendonitis? Boy, these are mouthfuls.
Yeah. Well done with those names, Mike.
I'm guessing. I'm probably butchering these.
All right. So let's first orient to the anatomy that we're talking about here. So I'm gonna share an image first here. All right. So what I'm sharing here, this is the front of the knee. Here's the kneecap. Here's the shin, and you'll see these are the muscles in the front of our lower leg bone. You can see there's not many of them, right? And they're fairly small. So when we have shin splints, we're talking about usually a chronic overuse of these muscles acting on the shin that then causes bony changes in the shin. Okay. Now I'm going to unshare that and I'm going to share the next group. So here are the muscles in the back of the lower leg. Look at the difference. I mean, let's just step back and look at the sheer volume dedicated to the muscles in the back of the lower leg bone versus the front. There's more than twice as many, all right? And they're huge. So on the outside here, most superficially, we have the calf muscle and the soleus muscle. Both start above the knee. Well, the calf does. And then the soleus starts below the knee, but they both blend into the Achilles tendon and insert into the heel bone here. So that's what this image is. And then here's a plantaris, which I think maybe 30% of the population doesn't even have. So you may or may not have a plantaris that mimics the calf muscle. All right, so in the second image over here, we have cut away the calf and soleus, and now you get to see the deeper muscles. Okay, so the first question was, I think the peroneus longus was her question. Why is that so irritated? And then the other one is the, tibialis posterior tendonitis, okay? So the peroneus longus is coming down here on the outside of the ankle bone, right? This lateral ankle bone, and it dips underneath the foot. The tibialis posterior comes down along here and goes to the inside of the ankle bone and comes in underneath the foot. So tendonitis in both issues, okay? And then we also have our shin splint guy. Okay, so this is the way the body works typically is when you have tendonitis, and tendonitis is almost, you never hear of a calf tendonitis. Well, you have a Achilles tendonitis, but you never hear of a calf tendonitis or a butt muscle tendonitis or, latissimus dorsi tendonitis. You don't hear about those things because these are all really massive muscles and they have multiple jobs to do with what they're doing. And typically they're designed to have these broad insertions and be your big power movers. Well, that's exactly what the calf and soleus are supposed to do. And so the smaller muscles, their job is to support the bigger players. So inevitably, wherever you are in the body, when you have tendonitis issues in these smaller muscles, it's because they're overworking, right? So regardless of whether it's peroneus, in physical therapy, we love to identify the exact muscle that's tender. Okay, well, whatever. It's still a small muscle, right? That is overworking. That's what itis is an inflammation usually due to overworking. So why is it overworking? Because usually the big players aren't doing their job. Okay, so what are the big players in this system? Well, the calf and soleus are clearly a big player, but also you wouldn't believe it, the butt muscles way up in the hip area are also a big player in this system too. But let's just stay locally here. So why wouldn't the calf and soleus be working? So here we are with the lower leg bone. So when the calf and why wouldn't the calf and soleus be working? Well, often it's due to one of the issues is shoe wear. So when we wear shoes that are really puffy, right, have super cushion, and that usually have a high heel, so the toe is sitting slightly below the heel, and then we have a foot strike pattern that is a heel strike pattern. The calf muscle has no reason to turn on, and I'm sorry, the calf muscle back here has no reason to turn on, and so it becomes weak and underused. So a heel strike pattern will turn off the calf muscle and the soleus, and therefore any use that is called upon by these muscles, it will fall to the deeper, smaller, tinier muscles instead. So that's one of the reasons why these deeper ones become more irritated and develop tendonitis, and that's why the calf muscle gets turned off. Now, the other cause, and it can happen concurrently, is that the calf muscle is actually, and soleus muscles are tight. And so when you are walking, your knee is supposed to travel over the foot at foot strike. All right. Now, if you have tight calf and soleus muscles, that restricts the ability of that knee to move forward. So instead of it going like this, it may just be going to here. All right. Well, if you've ever not seen something and run into it, like a table or doorway, you'll recognize that even just taking half of a step, our bodies generate tremendous forces when we are moving forward. It's like when you run into something that you didn't see that's fixed, it's like getting hit by an NFL linebacker. I mean, it's tremendous force that you're hitting and your body is generating. So all that force is trying to move forward, but now your calf and soleus tightness is restricting that. Where does that force go? Because you've got to move forward. Well, it can go one of two places. One is it can be driven down into the foot and then stress all the foot tissues, or two, it'll go back up to the knee. All right. And so when the calf and soleus is so tight, this also lends another. So both that peroneus and the posterior tibialis, if you saw it, they went underneath the foot. That's because they control foot pronation and supination, the flattening and arching of your foot. So when you have all this excessive force being driven down into the foot, it's causing those little tendons to have to work harder because there's too much force being driven down. And now all these little tiny tendons and things and foot muscles have to work a lot harder to offset this tremendous force. Okay, why would the calf and soleus become tight? Because of usually how we sleep. And so how we sleep, and this is going to get into the shin splints question too. How we sleep is usually our foot is pointed away from us like this. If we sleep on our back, the covers lie on top and they push our toes away. If we sleep on the side, our toes usually point down like this. And if we sleep on our stomach, then the bed is pushing the foot away. So that's 6 to 8 hours of calf and soleus shortening every night. All right, which then causes them to be weak. Now, if your calf and soleus are tight, what opposes the calf and soleus muscles? These front of these muscles here in the shin. So this is often why shin splints are occurring, is because these muscles are having to work too hard against an excessively tight calf and soleus. All right, so how do we solve this? Well, there's something that I recommend in my foot pain program called a dorsal night splint. And so what that does is it holds the foot in a neutral position when you're sleeping, and therefore the calf and soleus muscles don't get to shorten anymore. So when the foot is like this, these shin muscles are trying to pull the foot up for you. But the calf and soleus, you saw the size of them, they're massive. They're so tight, these guys will never win. So you need something else to help pull those toes up, and that's where the shin splint comes in. And then it will not only calm the shin muscles down, but it will naturally lengthen the calf and soleus muscles too. And when the calf and soleus muscles get to lengthen, and your knee can pass further over the foot at foot strike, then the foot muscles and tendons on the bottom of the foot don't have to work so hard against all of this excessive force because it's being dispersed throughout the whole foot and ankle system and knee and lower body system the way it should. And so all that posterior tendonitis, posterior tibial tendonitis, and the peroneus tendonitis will start to calm down too. Now, so ultimately, when you're in this acute stage of all this tendonitis, you can't make huge changes to your footwear because it'll just be too much. So I would recommend starting with the dorsal knife splint first. But I've also developed a taping technique to correct these excessive forces that are traveling down through the foot and irritating all of these tissues. And it uses one piece of tape, but it controls both the foot arch and the ankle. And it does so precisely so that while you're in the process of fixing all of this tightness, weakness, and so forth, everything being shut off, the tape will protect these structures for you, and it'll start calming down all this tendonitis stuff that's going on. All right, long answer for several problems, but hopefully that answers the question.